So the DESTINY-01 trial is just a continuation. It's a long-term continuation of what's already been seen. I mean, a year ago, they had a response rate, I think, of a disease control rate of like 97%, a response rate of 60%. PFS at the time, I think, was 16 months, an OS that hadn't been reached. And now with another year of data, an analysis, the PFS is now 19.4 months, and the overall survival is 24 months. The difference being that if that overall survival at 24 months, it's only 35% of the events that happen. So still only 65% of people haven't died yet. Thank goodness. And I think that just tells us, I mean, we're going to have to wait for the phase 3. I mean, we can talk about this till we're blue in the face, how exciting the data is, and it's very, very exciting. But on the other hand, until we see the phase 3 DESTINY-02, where it's being compared head-to-head to a standard therapy for third-line metastatic breast cancer, triple-negative or HER2-positive breast cancer, until we see that data, the actual phase 3, we can kind of talk about how exciting it is. Clearly, we're using it. There was one additional death from interstitial lung disease. So there were 5 total out of, I think, 184 patients on this phase 2 study. So that's kind of what we saw from it. And I think that it's very exciting data. I mean, I think, this drug will change the landscape of this disease if it hasn't already. And with especially these long progression-free survivals, of a year and a half or longer. And which you just never see. These patients have been treated with 6, 7 therapies in the past. And so, we'll see where it goes. I mean, again, we've learned something from the San Antonio, if anything. We've had a bunch of studies that look really, really good in phase 2. That, like, for example, etinostat, apatosertib are just 2 examples that come to mind that had great data, really, really good in the phase 2 trials. But then we did the phase 3, there was no benefit. And so I think, a lot of us are getting a little bit, not concerned, but, before we go and we're clearly going to use the drug. It really works. But I think that we have to wait for the phase 3. And I think that's coming up soon.